Good evening. I was just telling my table, like, I feel so inadequate because after the last two presentations, like, I can't top that. What I can do though is the beauty of it is we all bring something different to the table. And so when you're looking at the state of health and healthcare and what it looks like today is, if I were to tell you, I work at Cone Health. Cone Health is what? It's a what? I heard hospital. What else is it? Healthcare system. So again, the beauty of that is we are an organization that provides health and addresses health, but we're also a healthcare system. And so people interchange the two and they mix it up. And so when you're talking about health and healthcare, one of the things we are doing is, one of the things when you think about a hospital, when you think about a hospital, when you go to a hospital, what does a hospital do?
Sick.
When you're sick, right? Traditionally, that's what we're known as, is treating sick people. But we know that today, treating sick people is not going to get us to goal, right? And so one of the things we're looking at is we are a hospital that happens to be in a healthcare system that really looks at treating a whole person. So when you're talking about holistic care, everything y'all just heard from the mustard seed, they're providing holistic care, so mind, body, spirit, right? You just heard about the family justice system. They are a system that provides services not only for the elderly, not only for the youth, not only for women. So again, systems. Then when you talk about the Center for New North Carolinians, they are a system that's providing help. But when you think about each and every one of those connection points, they all provide a different service, right? Because guess what? We're one body, many parts. And in order for us to do that, when we're shifting in home, for instance, what we're doing is looking at not only being known as a place where you go when you're sick, but how can we be a place that helps you stay healthy? So when you're thinking about it, oh, I want to be healthy, what are some of the things that we can do to be able to address health? For instance, our new center, our new med center in Greensboro, which is at Drawbridge, where we have Sagewell Health. And it's a product, it's a service that provides you to be able to stay healthy, physical health. Then when you look at some of the things that we're doing in the community, such as our mobile health program. So again, when you look at traditionally how health systems work, it's we bring everybody to the hospital. You come to us, right? Well, that's not working. We have to do a game change where it's just like, okay, how can we reimagine how we deliver care? And it's no longer bringing people to the hospital. It's no longer even having you come to the doctor's office. So that's your ambulatory care setting. What it truly looks like now is, let's meet people where they are in the community. What does that look like? So if that means we need to do a pop-up medical clinic at a church, if we need to be at the temple, if we need to be at the synagogue, where are we being able to provide care in places where people feel safe and people feel comfortable? And so then we looked at it as, okay, what else can we do? We started our mobile health program. So again, we know that transportation is one of those barriers. So when I throw out there, and I don't want to assume, but does everybody know what social determinants of health is? What's the throw out to me what social determinants of health is. Give me one element of social determinants of health.
Reliable transportation.
Housing. Healthy food. Safety, thank you. A lot of people tend to forget about the safety component of a social driver of health. Because if you don't feel safe in your environment, if you don't feel safe in where you're going, that directly impacts your physical health. It impacts your mental health. And again, you can't address physical without the mental. And so one of the things we are doing with our mobile health unit is we have two units. So we have a Sprinter van, which is a lot smaller, where we can do screenings. But then we have a larger unit, which is a 42-foot unit, which provides, guess what, behavioral health services. Because one of the things is such a negative stigma around mental health, and people don't like to see that mental health. We have access on our mobile health unit to be able to provide that in one of our exam rooms and to be able to do a soft handoff to the Family Justice Center, to do a soft handoff to another, our new behavioral health urgent care center that we have off of 3rd Avenue. So really looking at when you're talking about building healthy and equitable communities, what are those elements to build a healthy and equitable community? And those are some of the things we're doing. some of the things you talked about, the connection points, and of course with me and my role, I work in the health and communities department. So a lot of my work is around looking at those upstream drivers of health and also health and looking at those downstream drivers of health. Again, downstream is once they hear they're dealing with this issue now, but what do we need to do to be able to address it so we can prevent some of those things? And so not working on them single-handedly, but how do we work on them together? And how do we partner with others in the community to be able to do that? And that's exactly what we do. We work with our faith-based community. We are working with, we recently just opened up a medical center because of the intersection between health and hunger and how that directly impacts your health. And so one of the things is we have micro markets not only within our organization, but we're working in the community, 2 community members back here now, where it's community ran. It's resident ran, where we are providing food, not only for today, but how do we help people live for tomorrow? Another thing that we are doing is looking at housing. So what does housing have to do? I work a lot with the Cottage Grove Collaborative around asthma and how asthma is treatable and is preventable. But again, us working together, so looking at it as that collective impact model. How do we all come together with the collective voice, and each person, like I said, one body, many parts, how we all can work together collectively to solve for the problem. And again, we are not the ones to determine what we solve for. Who's the one that determines what we solve for? The community. And that's, again, a lot of times when we go in and we see this issue and we're ready to jump in and like, oh, we go do this, we're gonna pop this up, we're gonna do this. And then you wonder why people aren't utilizing those resources, because we fail to engage the very people who we're serving. Not helping, but serving. And so my call to action for you today is really think about it. How can you walk in it now? So think about the areas where you live. Think about your neighbors, think about your friends, think about your employers where you work. How can you walk in your victory? How can you walk in your purpose? And how can you use the tools and the resources that you have in your community? How can you leverage other community resources and say, hey, we can be a part of the solution, but we can't do that unless we involve community. And one of the things we're really being conscious about is representation matters. Because when you talk about medical mistrust and why people don't go and seek care, when they're afraid, I'm going to get a medical bill and I can't afford this bill, because a lot of people think just because somebody is underwhelmed that they don't want to have good credit, you know? And that's a misnomer. We have to really look at it. What are things that we can do, and how can we create the conditions so people can be healthy? And we all have a place in that. And so again, I thank you for this opportunity. And it was hard to come after folks too, but knowing that we are really changing how we're showing up, and one of our commitments at home, again, is caring for each other, caring for our patients, but most importantly, caring for our communities. And we do that by serving communities well, and we can't do it single-handedly. So again, my call to action is how do we serve people well, and how do we walk in it so that others are able to have transformational change in their lives. So thank you.